Hello, my name is Jonathan Abrahams and I work in the Disaster Risk Management and Resilience Unit of the WHO Health Emergencies Program in Geneva. I'd like to welcome you all to this video presentation about Chapter 2 of the WHO Guidance on Research Methods for Health Emergency and Disaster Risk Management, which is entitled Health EDRM and Research. The presenters for today are Professor Emily Chan, Professor Virginia Murray, and myself. I would like to invite Professor Virginia Murray to begin the presentation and to introduce herself. Over to you, Virginia.
Thank you, Jonathan, so much. It's wonderful to be part of this huge piece of work for the WHO Guidance on Research Methods for Health EDRM. My name is Virginia Murray. I work in Public Health England, which is about to become on October the 1st, 2021, the UK Health Security Agency. Like Emily, I am a co-chair of the Health Emergency and Disaster Risk Management Research Network. And we have been working on this chapter 1.2, Health Emergency Disaster Risk Management and Research. The whole chapter is designed very much to provide readers to be able to understand the imperative for health emergency and disaster risk management as a transformational paradigm for managing health consequences and risks at all types of emergencies and disasters. And in the time of COVID, this has become even more important. It's there to describe the principles and approaches and components of the WHO Health Emergency and Disaster Risk Management Framework, and Jonathan will take you through that at length. It'll make the case to use and strengthen evidence and research to support health emergency and disaster risk management decision-making and practice, which frames the need for and the scope and the content of the guidance, and Emily will particularly share that with you. It'll help you to appreciate how this book provides guidance on conducting and/or commissioning high-quality research for health EDRM that meets the needs of those who will use it, a really important approach. Perhaps the most important part to start is with the consequences of emergencies and disasters. We always know that this data on risks and consequences of emergency disasters is dynamic. The data should be updated as required, and local data needs to be added. But the guidance on research methods, published in 2019, reports that we think that between 2008 and 2017, on annual averages, there were nearly 70,000 excess deaths, and approximately 200 million people affected every year. The economic losses are probably more than 160 billion US dollars, and of course tens of millions have been affected by conflict and related difficulties. There are many updated sets of available data. For instance, the humanitarian assistance showed that 235 million people were in need, according to OCHA. And natural hazard-related events, large-scale events that were reported by the International Federation of the Red Cross Red Crescent in 2020 showed that there were at least 285 events a year. The deaths were 74,000 a year, people affected 175 million, and the economic losses massive. But of course, in the time of COVID, we know that we've had such a massive increase in numbers. We've recorded that there have been over 4.5 million deaths since COVID was first understood. That there was something like 226 million cases. But the good news is that over 5.5 billion vaccine doses have already been administered at the time of this recording. Of course, we know that these consequences can include other types of emergencies, biological and technological impacts on epidemics, transport, air pollution, other health effects, which include injury, illness, disability, and mental health. And then there are medium and long-term effects on health, livelihoods, economy, and environment. But what I'm really pleased is that WHO has really worked hard to look at this, and they've now provided technical guidance notes on the SENDI Framework reporting for Ministries of Health on how to report and document these figures more accurately, as we can only manage what we can measure really well. And we've also been working hard on trying to understand how we define the hazards, but more on that now. WHO has a classification of hazards with groups and types, which include natural, human-induced, and environmental. And there are many of those different hazards. And we took this as a really important statement to be able to share with many for UNDRR and the International Science Council to look at hazard definition and classification review. And our classification review identified over 300 hazards, 302 to be precise. And each of these hazards will now have a hazard information profile that should be published on October the 1st, 2021, to provide much clearer definitions for each of the hazards and how they can be defined. Now, there are many risks associated with emergencies and disasters. Many communities are experiencing the risk drivers from unplanned urbanization, climate change impacts, weak health systems, and exposure and vulnerability exacerbated by poverty, living in risk-prone areas, inequitable access to health and other services, social determinants, age profiles, and emergencies have devastating impacts on community and country development, with impacts on pathways to universal coverage, and of course, overwhelmed health systems and decimated economies. So managing risks of emergencies and disasters are really where we need the research. So the actors across many disciplines in health and other sectors can help to prevent hazardous events and the health effect. And we really want to try and find ways to stop events becoming emergencies and disasters by preparing for their occurrence and responding to and recovering for them. But to do this, these actors must have access and use research to inform their decision-making and practice. And where uncertainties remain, they must be able to resolve these uncertainties by facilitating new research. The SENDI Framework for Disaster Risk Reduction, which came into force in 2015, adopted by all the UN member states and continues to 2030, is only one of the incredible 2015 UN landmark agreements. So you see on the right in the image that on 2015, we had the SENDI Framework agreed, the Paris Agreement, and the Sustainable Development Goals. And the lines that reflect to these agreements really show how long it took the international community, the global community, to engage to try and deliver this. And by bringing it all together in 2015, we have this incredible vision for what we should be able to do. So the SENDI Framework is a global agreement that is part of the 2030 Agenda for Sustainable Development. It has an increased emphasis on health, over 30 references, extensive links to science, evidence, and research. So it's really important that we improve the health emergency disaster risk management to build that scientific evidence base that is so needed. And the evidence and research is critical to the World Health Organization Global Programme for Work 13, which includes as one of its 3 priorities the fact that 1 billion more people have better protection from health emergencies by 2023, a very tight timeline. So I just want to take you to the health emergency and disaster risk management approach that WHO has been leading on. You'll see on the right the WHO Health Emergency and Disaster Risk Management Framework. This framework was specially delivered in August 2019. It reflects so much of the SENDI framework, but so much more. It's about prevention, preparedness, and readiness. It's about response and recovery to save lives and protect health. It takes the entire health system, but also the whole of the society working together, not one sector working alone. Most importantly, communities are at the center. High levels of vulnerability for those who are poorest, women, children, people with disabilities, older people, migrants, refugees, displaced persons, people with chronic diseases. These people are the core that we're trying to look after. It's about reducing health risks and consequences of emergencies, vital to local, national, and global health security, building resilience of communities, countries, and health systems. Jonathan, can you tell us more about this really valuable framework, please?
Yes, thank you very much, Virginia, for setting the context for the Health Emergency and Disaster Risk Management Framework. You know, when we look at health emergency and disaster risk management, it has many dimensions. It reflects the very nature of risk. Risk has got the components of hazards. It has vulnerabilities, exposure, and also capacities. And when we look at the field of health emergency and disaster risk management prior to the Health EDRM framework, there were many other global, regional, national frameworks that addressed one of these dimensions, or perhaps many of those dimensions. But there was not an overarching framework that brought all of those elements together. So, for example, there's the International Health Regulations, which is more or less focused on infectious diseases, which have the potential to cause public health emergencies of international concern, as well as chemical and radiological events. We also have had many guidance that relate to specific functions, such as the Public Health Emergency Operations Centres, and guidance that addresses components such as, or elements such as emergency preparedness. There's been many other frameworks that address specific sources of vulnerability, such as gender or disability. But each of these is somewhat fragmented and makes the case for Health EDRM framework, which really reflects the systemic nature of risk and the systemic capacities that are required to manage those risks. Equally so, there have been other frameworks in the multi-sectoral domain, the main one being the Sustainable Development Goals. And then there is the SENDI Framework for Disaster Risk Reduction, amongst many others. These speak to public health, where health is an outcome, which these frameworks are aspiring to achieve, better health and well-being. Their health as a source of vulnerability, people's health status, as well as infectious diseases as being a source of risk, that all of these sectors need to work together, they need to collaborate in order to ensure that those risks are reduced and managed effectively. It's also been important that the health sector and people who are contributing to the management of health risks are able to align and apply these multi-sectoral frameworks. And the Health Emergency and Disaster Risk Management Framework does that. So in this slide, it's actually acting as a bridge across all of those other frameworks related to health, but also with the multi-sectoral domain. The Health Emergency and Disaster Risk Management Framework, which Virginia introduced, really aligns these different agenda: health security, disaster risk reduction, humanitarian action, climate change, and sustainable development. It safeguards and protects the development and implementation of these other frameworks, such as the SDGs, the Pathway to Universal Health Coverage, the SENDI Framework, the International Health Regulations, the Paris Agreement, and many others. It's imperative that that risk is managed in order for development to flourish and be sustained. It is this bridge between health and multi-sectoral communities, but it speaks also to the many disciplines within all those sectors and also within health systems. It brings together good practice from health systems, emergency and disaster risk management, epidemic preparedness and response, and climate change into this holistic and comprehensive framework. And if you look closely at the Health Emergency and Disaster Risk Management Framework, you'll see that it really provides common language. It really tries to de-emphasize technical jargon and thus provides a common language for all actors within health systems, in health and other sectors, who are working together for improved health outcomes and well-being for communities at risk of emergencies and disasters. It's really important to show how everybody within the health system is contributing to managing that risk before, during, and after emergencies. And of course, it's a framework that speaks to all types of hazards, all risks, events of all scales, whether they come from associated with biological, natural, technological, or societal sources of risk or hazards. As was mentioned earlier in the objectives, there are so many challenges associated with the managing health risks and consequences of emergencies and disasters that we really do need to see a transformation in our approach to the way in which these risks are being managed. And on the left-hand side of this slide, you can see the more traditional approach, and the right-hand side is the future that we're trying to achieve through the risk management framework. In effect, it needs to be risk-based, not event-based. Those risks are before, during, and after events. It needs to emphasize the reduction of hazards, the reduction of exposures, vulnerabilities, and the strengthening of capacities rather than being focused on hazards. It needs to adopt an all hazards approach, which means that systems and capacities need to be put in place and strengthened and sustained to address all the risks that a community or a country may face, using those common capacities and common systems. It needs to be far more proactive, needs to be anticipatory, and put a greater emphasis on prevention at the same time as dealing with response and recovery. As stated before, it's not about a single agency with this responsibility, it's the whole of society and many sectors working together. And it's a shared responsibility across the health system, not those who are just principally responsible for emergency preparedness and response. It's the contribution of all those working in primary healthcare, emergency medical systems, and in tertiary care as well. Once again, emphasizing this risk management approach and also planning with communities, where communities are really in the driving seat. They need to be involved in the design and delivery of activities that affect them. And more so, they need to be in that leadership role. So they're leading the process and setting the priorities for the actions that need to be taken in those communities with the support of all their partners. So the WHO Health EDRM framework, its vision is the highest possible standard of health and well-being for those people who are at risk of emergencies and disasters in order to strengthen community and country resilience, health security, UHC, and sustainable development. So this is no different from the vision for public health in general, the highest possible standard of health and well-being, but it's applied in this particular context of the risks of emergencies and disasters. And what we'd like to see through the application of the Health EDRM framework, the adaptation of this framework to local contexts, is that communities and countries have stronger capacities and systems to reduce the health risks and consequences of the risks that they face, of the different types of events that are relevant to them. Some of them are local, some of them are national, and some of them are global. And the risk management framework is based on guiding principles, which you can see here, which really pick up that transformational change that I shared with you on the earlier slide. Risk-based approach, comprehensive, meaning it's dealing with prevention, preparedness, response, and recovery, all hazards, multi-sectoral and multidisciplinary, inclusive, as was shared earlier, with all of the people who are at risk of emergencies with their particular vulnerabilities, their particular capacities, actively involved from the beginning to the end of the process, that it's whole of health system based, and really all of the actors are applying ethical practices and behaviours with respect to their engagement with communities and also their engagement with each other based on respect and trust and confidence in each other's abilities to do the job, and also to uphold health and human rights, particularly in addressing issues around equitable access to high quality healthcare without financial impediments. The Health EDRM framework has 10 components, and these really pick up a lot of the language of the health system building blocks. The first of those is policy, strategies, and legislation. And one should really be looking at these components as a matrix, in the sense that policy, strategies, and legislation apply across all the other components as well. These policy, strategies, and legislation can include doing effective capacity assessments and the development of capacity development strategies. Then we move on to planning and coordination, planning across prevention, preparedness, response, and recovery, ensuring that the coordination mechanisms are in place, such as emergency operation centres or health and multi-sectoral policy coordination committees. And it's here where also exercise simulations and after-action reviews come in. Human resources are vital in any system, and the Health EDRM framework puts a lot of emphasis on strengthening workforce capacity, the need to have capacity development programs, including training at any level, really, within universities, at undergraduate training, also in the workplace, and so forth. And there's an emphasis on the safety and security of health workers and other actors within the system. Financial resources are needed to support the work of Health EDRM, whether it be regular budget or contingency funding or safety nets and so on. Information and knowledge management is a key component when it comes to research. For example, in terms of the way in which research provides the evidence, knowledge, and supports practice in health, emergency and disaster risk management. It's vital to conducting risk assessments for early warning systems. And of course, we turn to research when we're looking to identify new or innovative risk management measures, which also includes the application of risk management measures from other sectors and how they can be applied in the health arena. Risk communications is a vital component, the way in which the media participates in health emergency and disaster risk management, how they can support effective behaviours of communities, risk communication and public communications, and also the management of the infodemic, which we see very prominent in the COVID-19 pandemic. Moving on to the second page on components, there's health infrastructure and logistics. And that infrastructure is not just about healthcare facilities, but also the community infrastructure in terms of power and water and sanitation, which the health sector may contribute to in a large way, but also is heavily reliant on that infrastructure for its effective performance, and also the way in which those infrastructure prioritise public health. Also see in this area emergency kits and stockpiles, and effectively having a good logistics system to enable the health sector to do its job effectively. Health and related services is often what we think about when it comes to health and emergencies in terms of the healthcare services, whether it be trauma care or mental health or reproductive health. All of these services need to be provided in times of emergencies. And then there are specialised services for specific hazards in terms of infectious diseases, chemical emergencies, radiological emergencies, and also the consequences of climate-related risks and also climate change. And then there's public health measures, which are more at the community level in terms of environmental health or immunisation programs. There's also an emphasis in the framework on community capacities. These include health promotion, the training of the local health workforce, and local healthcare facilities. Monitoring and evaluation is another one where there's an emphasis on the role of evidence to support effective monitoring of progress of systems and programs to meet health emergency and disaster risk management objectives, particularly when it comes to health outcomes, such as reducing mortality or reducing morbidity and other health consequences of emergencies and disasters, but also looking at how that's progressing in relation to economic effects of emergencies on communities and what are the health implications associated with those economic impacts. We need that evidence to monitor risks being very dynamic, and also to understand whether capacities are in place, whether they're fit for purpose, and how they can be strengthened to be able to manage this dynamic risk environment. We need that evidence to evaluate strategy, programs, and activities to see whether they are achieving their objectives. Are they able to implement the plans that are in place? Are they achieving the milestones that are necessary? Are they fit for purpose? Can we find efficiencies? Do they need to be changed? And do they need to be adapted because of changing circumstances? So all of these components are in the Health EDRM framework. And furthermore, in that framework, we have guidance on how to develop health, emergency, and disaster risk management strategies. And also, it describes the roles of all the various stakeholders, whether it be the stakeholders, whether they be in government at all levels, the community, the research community, private sector, and the international community as well, including WHO. This is also combined with Annex 2, which documents the 200 functions or so that are associated with all of these components. So each of these components breaks down into many functions that are really necessary to address the comprehensive nature of health risks and consequences. And each of them is important in its own right. But we've been applying the Health EDRM framework to other guidance. They have drawn on the framework, such as the glossary of health emergency and disaster risk management terminology. Also, as Virginia indicated, the technical guidance note on SENDI Framework reporting, which is looking primarily at these outcome indicators or targets of the SENDI Framework, many of which are relevant to public health. We've also recently published Everyone's Business, which is addressing whole of society action. All of the stakeholders who've got incredibly important roles to play in managing the risks of emergencies and disasters. And it really emphasizes the mutual dependence of all of those actors, whether they be in the health system or in other sectors as well. And of course, we have the WHO guidance on research methods for health emergency and disaster risk management. We're also seeing how we can influence the multi-sectoral strategies to ensure that they are addressing public health across hazards, vulnerabilities, exposures, and capacities. And an example of that would be guidance from the UN Office for Disaster Risk Reduction to show how health EDRM, infectious diseases, and capacities within the health system need to be integrated within the multi-sectoral strategies at national and local level, and also in the UN system to manage the risks of emergencies and disasters from all causes. It is now my pleasure to hand over to Professor Emily Chan, who will focus on health EDRM and research.
Health EDRM framework focuses on research. The framework concerns and highlights of the importance of the harmonization of the collection, analysis, and dissemination of data, information, evidence across relevant sectors. It also advocates for good actions to require good quality research. The platform also aims to synthesize evidence-based technical guidance to build capacity through training programs and health system improvements. Health EDRM Research Network was established in 2016 and formally global launched in 2018. There are three main objectives. It aims to promote global collaborations among academics, government officials, and other stakeholders. It aims to promote better scientific evidence to inform policy and practices for health EDRM. And it highlights evidence and research before, during, and after emergencies and disasters. WHO Kobe Center expert meeting in October 2018 calls for guidance on research methods for actors who are conducting research, commissioning research, and using evidence and research in their practices. Health EDRM research supports and implements WHO key role in research and innovation, as it is vital to WHO's as knowledge-based normative standard setting organization in the 21st century. WHO, as a global organization, hosts special research programs, coordinates multi-country research, and supports research capacity development. It has designated over 800 WHO collaborating centers in support of WHO. It works with partners to identify and coordinate research, development, and innovation. For example, to better detect, prevent, and respond to new and emerging diseases and other hazards that endanger health in contexts which is affected by health emergency disaster risk management, diagnostic, vaccine, and therapeutics forms, strategic shifts in diplomacy, advocacy, normative guidance, agreement based on science and evidence is urgently needed for multiple topics. And as a result, health EDRM research informs and is informed by many fields of research. For the 21st century, with the rapid advancement in science and technology and the lack of evidence, health EDRM has uncertainties due to the risk of the nature of its work and activities. Good quality research and evidence is thus required to address uncertainties which arise from limited knowledge, understanding, access to, or application of research evidence. The lack of evidence to support decision-making and actions of how common problems may be, how to reduce the risk of those problems that is affecting well-being of human population, and how to manage risks and events when they do occur. This guidance describes the types of research to answer these questions. The role of research in health EDRM is enormous. For example, research from systematic reviews, such as of Chapter 2.7, has informed the benefits of vaccination to prevent common diseases, potential strategies to improve water quality, evidence-based treatment for disease and injuries, and highlight the potential harm of interventions such as one-time debriefing to prevent post-traumatic stress disorder. Another example would be systematic review of existing research evidence, such as in Chapter 2.6, also drawing on organizations that aims to produce and maintain reviews, such as Cochrane, Campbell Collaboration, Joanna Briggs Institute, or organizations such as Evidence Aid that collate systematic reviews, produce collections of specific topics such as malnutrition, as highlighted in the guidance of Chapter 3.7. The discussion of research highlights it's important for policies and technical development of guidelines must prepare using rigorous systematic methods. There are many gaps and evidence in research for health EDRM to be applied for the 21st century. Where systematic reviews or studies of sufficient qualities are lacking, decision makers and practitioners should work with researchers and academic collaborators to design and conduct research to answer their questions. This book provides guidance on research management processes that will lead to effective and efficient research studies. The value of systematic approach to designing, conducting, analyzing, reporting, and using research. How to ensure research is reliable, robust, relevant, and fit for purpose, and meets the priority needs of those who will use it. And how to implement a research plan and translate its findings into routine, day-to-day practice, policy, and program direction settings. So as a conclusion, together with other authors, we want to highlight that emergencies and disaster have widespread effects on public health, economies, environment, and countries and community development. Risk and its drivers must be managed by reducing hazards, exposures, and vulnerabilities, and the strengthening of capacities of systems, organizations, and communities. Evidence-based health EDRM aims to transform policy, practice, and culture to promote health security, addressing climate change and safeguard pathways to universal health coverage and sustainable development. Health EDRM requires actors in health systems and other sectors at all levels to help to work together on applying measures across prevention, preparedness, response, and recovery. WHO Health EDRM Framework describes key principles, approaches, components, and functions required to manage the risk of all types of emergencies and disasters. While evidence and research has been used to inform effective health EDRM, many uncertainties remain that requires further studies and inquiries. This book provides guidance and case studies on conducting and commissioning research that meets the needs of users and community at risk of emergency and disasters, and hope to safeguard the well-being and health of population globally.
Thank you very much, Emily, and also to Professor Virginia Murray. This brings us to the close of this particular presentation on Chapter 1.2 of the WHO Guidance on Research Methods for Health EDRM. For further information, please contact myself, Jonathan Abrahams, at the following email address, abrahamsj@who.int, or Dr. Ryoma Kayano at our WHO Center for Health Development in Kobe. His email address is indicated there, and he's the overall coordinator of this particular project. Thank you very much.